I'm home after the surgery. It was this morning, and I had to be there at 5:45. Scheduled surgery was 7:30, and at the operating room from 7:30 to 10:30. I know when I woke up, I asked the nurse what time it was, and she said it was 10:10. So it took about 2.5 hours. I got a chest block, which I didn't know I was getting. Apparently it lasts about 18 hours. Pain relief. My chest is still sore, which I'll talk about in a second. Yeah, so I arrived, got the IV, met the anesthesiologist. Dr. Lyons came in, drew all the lines on me. I could probably still have those, but you can't see them. This is my fancy post-surgery bra. They gave me 2 of these. I can wash one. He told me I could take a full shower on Wednesday. It's Monday, so in 48 hours I can take a whole shower. He said just not to sit in a tub, and soak them, but a regular shower is fine. Washing my hair, I can lift my arms above my head, no restriction on that. I did not have any lipo though, so I don't know if that makes a difference. So they're very nice. I got IV in my hand, and they gave me a little painkiller first for the IV, so I wouldn't even feel that, and they gave me a painkiller in my chest before they did the chest block. And then, let's see, the anesthesiologist came in, gave a little pain block for the chest blocker, and I don't really remember that happening, but it's supposed to help for 18 hours, which I think I already said. And then they wheeled me down to the operating room. I had to slide off the one gurney onto the operating table, and that's the last thing I remember. My husband's going out to shovel the snow, because while I was in surgery, it snowed a lot, like 3 inches. My mom took me, because my husband worked overnight last night, so he wasn't home in time to take me, but he's here with me now. He's my nurse for the day. Anyway, so I came out. Sorry if this is disjointed, I'm still a little fuzzy. Came out of surgery. She asked me how I was doing. It's very burning sensation underneath. So she gave me an oxy right away. She said I needed to eat something first, so she gave me some saltine crackers, and my throat was so dry. Those saltines turned into a big ball of paste in my mouth. I couldn't swallow them. And then she gave me ginger ale, and I was trying, but basically I just had a big ball of saltine paste in my mouth. Did my best. So they took the oxy, and then she checked on me about 10 minutes later, and by that point I was more awake, and I was like, okay, it's not just burning, it really feels heavy. I feel like they've been wrung out, like someone grabbed them and just twisted them, and hard, and like you're wringing out a towel. That's the best analogy, I guess, for how they felt. And she's like, okay, we're gonna put something in your IV because it'll be a quicker relief. So she gave me Dilaudid. I don't think I've ever had that, and it made me so tired, but they really want you to go home. And I was like, oh, now my legs feel like they weigh 100 pounds each. And I told my mom, okay, let's just help me get dressed so I can go home, because they just keep coming in and saying, how are you doing? how are you doing? Do you feel like your pain's under control? And it was much better. It was probably down to like a 2-3 at that point instead of a 6. I hate the pain scale, by the way. I don't know how to use the pain scale. I just know it hurts. So we loaded up in the car and came home, and they sent me home with a week's worth of Oxy, antibiotics, Tylenol, anti-nausea medicine, and I think stool softener. I haven't seen the meds, but they had us pick them up from the hospital pharmacy to make sure that we had them with us. We didn't have to stop anywhere. So my mom got them from the pharmacy while I was in surgery. I made, this is a guest room, so I made this into my little recovery room that I'm going to stay in for probably the first week at least, because I have dogs and they love me so much and they want to climb on me, and I don't want that. So this was a really good idea. I have no dogs, it's clean, it's quiet. I don't have to deal with anybody. I can just text my husband and say, I need something. So that's where we are on day 1. And now that I'm home, by the way, the pain is mostly right here underneath on both sides. In an hour, I can have another Oxy, and I'll probably take another nap. I ate ahead of time. I made 2 soups, and I made I don't eat meat, so I made vegetable soup and I made tortilla soup, and then I made corn muffins and lemon poppy seed muffins to have available, just so I could grab something. So I had a lemon poppy seed muffin and a glass of milk, and I'm hoping I get another drug and I go back to sleep. And I'm laying here in my big old pregnancy pillow. This is what I wore to the hospital, this button-down shirt. I saw people in their jammies there. This is actually a real shirt, but it's so soft, it's like jammy material. So I could sleep in this. I just wanted to wear something I wouldn't have to change when I got home. So that's the story so far on day 1.